Welcome to the Health Links podcast, presented by the Health Links family of services. I'm your host, DJ Thatcher. Our goal here is to engage in conversations about the health and medical landscape of South Carolina so we're all better informed. And remember, our podcasts are now video-based, and you can see our guests, and also, as we will have today, maybe certain images that they have as well. So be sure to check that out. We're joined today by Dr. Ed Nolan, the founder and director of Trident Pain Center. Well, Dr. Nolan, welcome to the Health Links podcast.
I'm so pleased to be here. I can't tell you.
Now, I know pain is the number one reason that people seek medical care. Is that correct?
It's one of the biggest reasons, yes.
So tell us a bit about Trident Pain Center.
Well, it's a wonderful organization, of course. I started it 22 years ago. And we started out at Trident, and now we have 6 locations. We have 4 across Charleston, and then we have 2 up in Columbia.
Okay. So there's no shortage of options for patients who are experiencing pain. So what is it that makes Trident Pain Center unique?
Well, we do offer just about everything that's available for pain management. We not only do we do interventional pain management and then medication management, but we also offer spinal cord stimulators. We have pain pumps, morphine pumps. We even have access to hyperbaric chambers through our wound care practice. We have a very wide variety of things, and if it's available for pain management, we have it.
Terrific. So a person having pain comes to you. I guess, first of all, what are the root causes of most of the pain that you see? Is it from injuries or illness or what?
Most of it is from aging. Reality is that we get older every day. No, I mean, it affects all of us. You know, I have that discussion with patients literally every day, sure. How every day we're being affected by our increasing age, and it happens to all of us. And sure. So, we do concentrate on spinal pain, particularly. The orthopedic surgeons will do like shoulders and ankles and knees, but they'll refer them to us too after they're finished. But we do a lot. We do have a real concentration on spinal pain, neck, mid-back, low back pain. And then a lot of pain that occurs with patients originates from the spine, as you know. And we really do concentrate on that because we can solve a very large amount of a patient's pain, concentrating on the spinal procedures and taking care of the spinal issues.
Okay. So walk us through, if I'm a patient coming in, and knock on wood, I have no pain, but maybe I jinxed myself there. But I'm a patient coming in, I've got chronic pain. How do we decide whether I simply take a medication or undergo a procedure? Walk us through what that diagnosis is like.
Well, we do have a little bit of experience in this.
I bet.
So when you come in, we take a look at you and we decide what kind of radiographic studies like x-rays or MRIs that we need to order. Often patients are referred by neurosurgeons or orthopedic surgeons, and so they've had all those studies done. And then we'll look at them, and we'll also assess the pain that patients are complaining of. And based on our experience and our training, then we will come up with a plan. We will either order, physical therapy. We'll order x-rays, MRIs. We'll consider pain meds. Mm-hmm. And then we also add injection therapy to it, because it really takes everything put together to take care of most people's pain, because a lot of people, they just want to come in and take a magic pill. Well, there is no magic pill. There are things that can help significantly, but if you ask the average pain patient, does the pain medicine take your pain away? They're like, no. So what we do is we're trying to give patients as much of their life back. That's our goal, is to restore as much function as possible, not just reduce pain, but to also give people their ability to live, to go places, enjoy life, enjoy the grandkids, be able to go out to the beach, go on the boat, go be able to do things and go back to living again. Just as simple as just going down to the store and being able to buy groceries is a big deal for a lot of these people.
I realize your motto is quality of life for all. So
yes,
that speaks to that. So you mentioned a moment ago about how you get referrals from neurosurgeons and so forth.
Yes.
Can patients just contact you directly, or must they have a referral?
Oh, they can contact us directly. If we do, most insurance companies require referrals these days, but we can go back to their primary care. We do that a lot with TRICARE. They'll want to come to see us, and then we have TRICARE sends us a referral. But we can go get the referral for them if we need to.
Terrific. I know you're not alone. You have a large staff of physicians and nurse practitioners and physician's assistants, and also you have a clinical psychologist on the staff as well. And how does that person's role fit into everything?
Well, pain can have a significant psychological effect on people. I mean, that's one of the biggest things that we're dealing with. You know, the biggest thing that I try to convey to patients is that there is hope. Patients are very discouraged. They have been suffering from this for years. They have often not had much help or feel like there's not much attention paid to their pain or not taken seriously. And the thing that we do is we sit down and we talk and we listen to them and we take it serious, and we want to convey that there is hope. The majority of our patients get significantly better. The majority.
Okay.
So, you know, every once in a while you'll find somebody who is a very special challenge, but for the most part, we accomplish great things. And part of that is working with a psychologist so that they can sit down and find out what part of pain can be from previous bad experiences. And so that's part of dealing with their pain, is because, you know, if you can get them where they can handle things better, they can handle the pain better. They can handle the stresses at home better. They can handle, you know, the family member who's driving them crazy better. So,
sure. Makes sense. Hey, tell us a bit about your professional background. You're a physician. You're board certified in anesthesia. Also did a fellowship in pain management as well. What is that whole process like?
Well, I went to MUSC for med school, and then I
so you're local.
I general surgery internship. I wanted to see what it was like before patients came to the OR, and then we took care of them in the OR from an anesthesia point of view. And then after I graduated from the anesthesia program, I participated in a chronic pain fellowship at MUSC, and then stayed on for years, over 15 years, as a clinical professor at MUSC. And I even helped train some of the pain fellows. In fact, one of my pain fellows I train currently works for me, Steve Jabert.
Well, good. That's good. You made a mention there. You did an internship in general surgery, which is not required for anesthesia. Is that right?
It was maybe a little overboard.
You're an overachiever.
Oh my goodness. That was probably one of the most challenging years of my life. I'll be honest with you. But it was good, because what's funny is now I know all the surgeons really well, because I was actually an intern with a lot of them. And they, you know, I know them very well. I mean, we spent hours in the OR together, or we, you know, even after in for anesthesia training, while they were training as surgeons, I did their anesthesia for them. So I know most of the people, most of the doctors in town really well. And then over the years, we've gotten to know them too in general and practice.
Well, terrific. Well, I know you brought with you today some devices, we'll say. Now, for our listeners on the podcast, hey, do check out the video component of this. So do keep in mind that some people might just be listening. But what are some of the devices that you brought with you, Dr.
Well, I'm not sure how clearly you can see this. Let's see. Okay.
It looks pointy, and I don't know.
It's a plastic tube, and when you advance it, I don't know. When you advance it, there's a little tip that comes out. Well, this is called a sphenocath. I was actually one of the first ones to implement this in the Southeast. And what you do is you put them under the X-ray machine, and you put this up the nose, and then you advance the thing, and it puts a little crook in it, and it puts it right where it needs to be. And we inject lidocaine, local anesthetic, in there, and it will take away somebody's migraine headache in a way that it is one of the most dramatic things I've seen in my life. This is one of the, I know it doesn't look like much, it's just a little plastic tube, but it is very dramatic, the results that can take place with that. It's really amazing.
So for someone with a chronic migraine, how long would a treatment last roughly?
All right, so it's interesting. No. It's very interesting. Typically we see 3 months on the first one, first maybe 1 or 2, then we get 6 months.
Wow.
And then we get a year or 2, and then I never see them again.
Interesting.
I mean, I had a lady, I grew up in Boiling Springs, South Carolina, and I had a lady come down from Boiling Springs. She goes, and so we were talking, and I asked her where she was from. She told me that. She goes, I know you don't know where that is. I'm like, well, what street in Boiling Springs do you live on? Because I knew it very well. And so I did that, and she got about 3 months the first time and about 6 months the second time, and then got 3 years the next time. And then I didn't see her for like 3 or 4 years. And when she came back, her husband told me, he said, you know, you gave me my wife back. Wow. Because she had been in a room with, you know, a wet washcloth on her forehead with the drapes closed and in the dark, you know, regularly, like maybe 3 times a week or for long periods of time. And she stopped doing it. I mean, that's one of the most dramatic things. I didn't mention that earlier, but it's one of the most dramatic things I've ever seen. Of course, the insurance company doesn't pay for it, so you have to pay several $100s out of your pocket. But if you're suffering from migraine headaches, that is one of the most amazing things I've ever seen.
Terrific. What else did you bring along then?
So this is one of my favorite things. I know it. A morphine pump, a pain pump. It's implanted inside the body. There's a little plastic tube that attaches to the side of it that runs around. And we actually refill this through the skin about every 30 to 60 days.
That's implanted in the abdomen, I take?
It's implanted in the abdomen. And then a lot of people don't offer this to patients because there's not a lot of money in managing it. So I did my very first business partner, Jeff Fauberg, Dr. Fauberg, was one of the largest implanters of morphine pumps or pain pumps in the country. And when he retired, I inherited those. And I had to decide, I said, you know, am I going to keep these pumps or am I going to have them taken out? And I interviewed patient after patient after patient. And they said, it gave me my life back. It gave me my life.
Wow.
It gave me my life. In fact, one of our doctors was just dictating, had seen one of our pain pumps. And she said, she was dictating, the patient said it gave them their life back.
Wow.
And I was walking by and I was like, oh, that's exactly why we're doing it. So, you know, it's everything. We want to have everything. We want to be able to offer a wide variety of things. And we want to take good care of patients. And I've never been hurt in my entire career. I've never been hurt by doing the right thing for a patient.
Terrific. Now, looking at the pain pump, it looks like that's something that's pretty extensive. I take it that's not a first line therapy. This is down the road after other things have failed.
Usually MUSC puts them in for us. The doctor's down there, and there's also a place up in Lexington, in Columbia, that will put them in for us as well.
All right, so Dr. Nolan, you also brought with you a spine and something that looks like a pacemaker, but I know it's not.
Well, this is a spinal cord stimulator. We do the trial, and then we have a neurosurgeon implant it. But it can also be very effective. It helps with people who have radiating pain down their legs. What we do is we do on both the pain pump and the stimulator. We do a trial first, see whether you like it, and then if you like it and want to proceed, then what we'll do is we send you to the neurosurgeons, and then they actually implant it into the spine. So you just take and run a lead into the spinal canal, and it has little areas on it where the stimulator can do electricity. And so you feel a little buzzing feeling instead of pain. And what that does is it overcomes the pain sensation. So as the pain is traveling up the spine, this stimulator puts this little buzzy feeling and blocks that signal from getting to the brain. And it can be very effective. I'm telling you, people come back with this and they might have been suffering for radiating leg pain for years and years. And we put this in them and they come back and they say, oh, it's just such a relief. So it's really kind of, there's a lot of amazing things out in medicine these days that we have available to us. And it's just, it's really a lot of fun to be able to take someone who's in misery and make their life better.
Well, we can definitely see your passion for this. So thank you. You have a couple of offices in the Midlands, not just in the Low Country, right? So.
Yeah, there was a Dr. Brandt up in Columbia, and I had 3 people called me on the same day and asked me, say, hey, you need to go talk to Dr. Brandt because their Agape was getting ready to close their pain management portion up in Columbia. And so I called Dr. Brandt, and he was very well trained. He's a good man. And so we brought his patients of 20 years, 28 years sometimes, on board, and brought his staff on board and got him an office. And he worked for us for years, and then he died of endocarditis.
Oh, no.
So then I had this office up in Columbia, and I was like, what are we going to do with it? And so I started going up there and helping to cover it. The patients were just so wonderful and just so appreciative and so kind. And I said, well, we're either going to have to close this thing down, or we're going to have to do it right. So we poured resources into it. And now we have 2 very large offices up there, very well trained interventional pain doctor up there, Dr. Antonovich. And we have 2 really incredible PAs who, one of them was the former commander of the Fort Jackson medical clinics there with like 400 people under him. And then the other one was his boss, Ed Gage. Oh, wow. So it's funny, we got 2 of the most incredible majors from the Army who are working for us up there. And just it's just an incredible thing we have going in Columbia. So I'm very pleased with that.
Terrific. And then your offices in the Low Country, they're in which areas?
Well, we have one in a really big one in North Charleston. We have a Monk's Corner office, West Ashley, and then Walterboro. Okay. When I first started, probably a third of my patients came from Walterboro. And I'm very loyal to Walterboro, I'm just saying, because they've been very good to me over the years. And I have tried to reciprocate that by taking good care of the people of Walterboro.
Well, that's terrific. It's one thing that we've talked about in previous podcasts about the sometimes the inequity of healthcare around the state. It's great in the metro areas, but in the outlying areas, sometimes it's a scarce resource. So terrific for doing that.
And Walterboro, it's kind of like Columbia. They're just so kind and appreciative, and they are just wonderful people out there. And I feel like we need to be there and help them.
Terrific. So. I also notice as part of your practice, you have your own pharmacy in-house as well. Is that correct?
Yes, we do. There's a lot of obstructions to getting treatment for patients. And if I run into a problem finding resources for patients, then I have a tendency to create my own resources.
Okay.
So that's why, I even started a wound care practice to have hyperbaric chambers for my pain patients. And I know that kind of seems like going around to get to what you want, but we have a pharmacy, we have a compounding pharmacy, a retail pharmacy, a compounding pharmacy, and a sterile infusion pharmacy now, which is kind of interesting. And we have a home health company, and we have a lot of different resources. Okay. We have supplements. Right. We have all kinds of things.
So you have a one-stop shop practice, obviously.
Yes.
So, well, Dr. Nolan, people who are out there watching or listening and they're in pain, how can they contact your practice?
Well, it's a very easy number, 843-797-3636. And all you have to do is call us, and we have a very pleasant staff. I have Charlene, who is the first employee I ever hired almost 22 years ago. She just happens to be on a cruise right now. Charlene will be glad to talk to you, or Sandy, or any of the ladies that are there who are just very sweet and kind. One of the things you'll find about our practice is we specialize in sweet and kind people.
Good. Well, that's good. That's terrific. And the website is tridentpaincenter.com.
Yes.
All right. Well, Dr. Nolan, thank you so much for stopping by the studio and letting us know about your practice.
It was my pleasure.